Hey everyone, welcome to the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is Dr. Jason Stein, the Chief Medical Officer of IngeniousMed. Dr. Stein, so excited to have you here today. Let's dive right into some questions I immediately have. Let's kick things off with your background. Could you briefly describe, your background and also, the work that you've done with IngeniousMed and OneUnit?
Yeah, absolutely. Jared, it's nice to be here with you today. So I'm a physician, a hospitalist, and IngeniousMed is a company that I co-founded right out of residency in 2001. So we've been in business for almost a quarter of a century. We invented electronic charge capture, as far as we know, and I worked with IngeniousMed for 5 years before spinning out for a career in clinical research and quality improvement, high reliability, and did that at Emory University, and have come back to IngeniousMed now in the last 2 years and bringing some of those high reliability strategies back into the company. We've done some additional work around structured communication in hospital units, and some of that work informs what I've brought back to IngeniousMed.
What would you say your favorite part of your job is?
Taking care of patients. So I still work clinically, and that informs the work we do for software design for clinicians. In the software world, I think I have a similar response. It's listening to customers. So really getting understanding of what the need is, what the pain points are, and then doing what we can to address and solve.
I wanted to tee up, Dr. Stein. You recently published an independent report about advancements in revenue cycle management. Can you walk us through some of the key findings of that, especially the shift from optimism to tangible investments in AI in smart analytics?
Yeah, absolutely. So, yeah, as a matter of background, for a second consecutive year, IngeniousMed commissioned an independent research survey. We surveyed financial leaders in physician practices. So, think physician practice CFOs or revenue cycle leaders. And while the survey was about RCM or revenue cycle management broadly, our findings illustrated a shift in mindset, and it's specifically taking place regarding artificial intelligence. And we're seeing in the survey that it's going to increasingly have an important role to play in revenue cycle, and that's changed significantly in just the last year. So how's it changed? Basically, in our 23 survey, financial leaders, we would say they were optimistic and maybe even circumspect about the potential for AI and revenue cycle. But here we are, just a year later, it's 2024, and the same physician practice leaders are actually now planning to actually invest in AI. So going from optimism to an idea that they're going to invest over the next couple years. And again, it's to reduce revenue leakage. I'm sure we'll get to that in a bit. But what's even more interesting, Jared, is their expectations for those AI investments are sky high. So not just better revenue capture and cost savings, but they're communicating to us through the survey that they're expecting double-digit lifts in revenue. So what our survey is revealing is that there's a brisk evolution. It's in the hearts and the minds of those healthcare financial leaders going from optimism to actual investment this year.
So let's talk about, in the research, there's also pain points like denials, underpayments, days in accounts receivable, and those have continued to persist in 2024, right? So despite advancements in AI, why do these issues still remain today, and what steps can healthcare organizations take to address them?
Right. So a great question. What's the chronic condition that we're dealing with here? I guess it's hard to overstate the headwinds that physician practices face in getting the most out of their revenue cycle. Um, Basically, what we're saying here is, just getting paid for the work that we physicians do every day. Every year, there's something like $370 billion in uncompensated care. I think that's American Hospital Association data. And so that's right, that's care that we deliver every day that a practice like mine, we just have to write off. So you add those headwinds and uncompensated care to like the march of denials from insurance companies and the drip drip of underpayments. Insurance companies are pretty good at figuring out how to pay at a level and not above it. And physician practices just get these stiff headwinds that push the practice backwards, making it harder and harder to thrive.
Now, one thing I know our audience is going to want us to talk about here is healthcare costs. And those are projected to rise another 8%. Sorry, everyone, but they're projected to raise another 8%. So, and that's next year. How critical is it for healthcare providers to optimize the revenue cycles now, though? And what would be the consequences of delaying any action?
Yeah, another good question. The big picture on that is that healthcare organizations continue to not be able to simply afford missing revenue opportunities in really any significant volume. The temperature of the water just keeps getting dialed up. Margins are slim. Solvency is a concern, and you're seeing bankruptcies. One of the largest physician staffing firms filed for Chapter 11 almost exactly a year ago, less than a year ago. And so what our research and the companion report that's available at the IngeniousMed Med website is saying is that while today's revenue cycles are stressed and manual and labor intensive and under supported by RCM solutions, to put it mildly, there's considerable room for improvement.
So actually, I want you to hit on that some more if you don't mind. So can you elaborate a little bit on how an underperforming RCM can affect the revenue stream? And then what impact are you seeing this have on healthcare organizations?
Yeah. So let's talk a little bit about sort of how RCM solutions are kind of failing physician practices. Our survey is really sort of a reality check of sorts about that underperformance. So 2/3 of respondents said that their existing solutions work only somewhat well at charge capture. So that means that 2/3 are decidedly neutral with their revenue cycle management solutions. Only 1/3 said that they were actually satisfied. And here's why, right? Here's your question. Here's why they're so underwhelmed. 13% of charges still go undercoded. And what that is, that's revenue that's leaking from their practice. That's revenue that physicians potentially earned, or they've done the hard work, but they're leaving it on the table. That's a lot, 13% to leave on the table. And meanwhile, another 7.5% or so of charges continue to be overcoded. So that's unintentional overcoding by a clinician, and that has its own set of problems. But if you add that up, what you get is about a miss rate for RCM solutions of about 20%. So 1 in 5 charges are either undercoded or overcoded. It's no wonder that physician financial leaders are kind of underwhelmed by the solutions that they have in place. But here's another thing. It's not as if physician practices haven't been investing to try to solve the problem. They've been investing, and it's expensive. Again, from our survey, nearly 80% of healthcare organizations are spending at least $100,000 a year on their RCM solution, and half of those are spending more than $500,000 a year on RCM solutions. So again, physician practices are investing in RCM solutions, but it's expensive, and those solutions fail as often as 1 in 5 times.
Let's talk about, in your report, it said that healthcare organizations are leaving an average of right around 11.4% of total revenue on the table due to things like coding issues and other underperforming solutions. So, can you talk about the financial and operational implications of a revenue leakage?
Yeah, I mean, it's not all doom and gloom. A couple of our survey findings paint a picture of transformation that maybe is already underway. Uh, so here's one. This year, more financial leaders in our survey are saying that they plan to invest in AI, 43%, compared to just last year, which was 27%. Again, that's 43% this year, up from 27% in 2023. Here's another finding. The majority of those leaders, 73%, believe that AI is going to be widespread in RCM in 5 years. I mean, that's a really significant expression of belief, right? 3/4 of financial leaders saying it's going to be widespread in the water in 5 years. But I would say equally important, fewer leaders are saying that they have no plans at all to invest in AI. Specifically, 57% last year had no plans at all to invest in AI, and that's down to 47% this year. And whether or not that's technically a tipping point, I don't know, but certainly the fact is that more than half are planning to invest in AI for RCM. It's signaling something about a change in their expectations. Um, I mean, you might ask why they're so bullish, but I think what they're saying is they see AI improving a whole range of RCM. We've all got a chance to play with GPT, and we've seen AI kind of come into some of our office applications, right? And so you kind of begin to see how things like coding and charge capture and even denials management and payment processing could be affected. Well, one of the startling things, Jared, in the survey wasn't just like whether AI was going to have a role in RCM, but how much. So another key finding in the Ingenious Med survey is that financial leaders are expecting, they have a belief that they're going to see a revenue uplift of as much as 20%. And I mean, that's a lofty figure, and I think that tells us something.
I'd love your take on this because I recently read, it's actually fairly recent, like probably this morning it came out, or it was last night, that I think was from Reuters, that like a ChatGPT, right? They're experimenting with potentially upping it. This is for the consumer one, but from $20 to $2,000 a month or something like that, right? I don't know. It's just a rumbling, and they might do some stuff with it. But then it actually sparked a really good discussion. Is there value if you upped it by that much? If it was able to, do what someone was saying, it needs to. It can't just do basic stuff. It has to continue to improve to do the job of like what would be like a $8,000 a month job, right? So something that I would love your just quick take on. Obviously, this is still new, and it might just be a rumor, but as this is something I think people aren't talking about as much, as AI continues to get so great, and the price goes up, that will be the price of all services, right? Because it's providing a greater value. What do you think? How do you think expectations are going to be raised within the health system, right? Because you have some great research here, and it says one of the key stats I like, that 73% of executives within these health systems expect AI to be widespread, specifically in revenue cycle management. But it would be curious to see how. I just want your thoughts on this. This is just something that came up. This is like in my ear, breaking news, potentially. Yeah.
Yeah. No, I think there's a reasonable chance that that consumers, whether they happen to be patients in healthcare or office workers or patrons of restaurants, our expectations are going to rise with the service levels that we see, or the feature enhancements, or the convenience that we begin to see from AI enabled versions of things we were used to experiencing. And so I think it's going to become increasingly challenging for vendors to get away with charging, right? It's going to, we're already seeing it in healthcare. We see physicians expecting things that they have become familiar with GPT or with Gemini, or when they write an email or a chat and there's predictive responses. They're asking questions like, why can't the EHR just do this as well? Clearly the technology is there. So I do think there's going to be a bit of a leveling out there, that'll probably have a kind of a depressing effect on how much vendors can and will get away with charging for those features.
Last question for you, Dr. Stein, as we wrap up here. So finally, with leaders bullish on AI driving new revenue, as you mentioned, in specific areas like payer payments, coding, denials, prevention, what does the future of revenue cycle management look like over the next 5 years? And then how optimistic are you about the role AI will play in overcoming the existing RCM challenges that still exist today?
Yeah, I think a couple of things. As this plays out over the next couple of years, I think you'll see AI inside of revenue cycle management offices create some efficiencies. The same number of people will probably be able to do more with less. But what's on the other side of the table, you've got payers who are going to have the same resources and tools at their disposal, and so it's not hard to imagine that there may be some kind of neutralizing effect there. But I think there's some coming off of AI for a second. I think there's some things in the revenue cycle world that we're going to begin to see that aren't even AI infused, but just more high reliability organization infused. And an example of that would be this. So at IngeniousMed, we've just recently launched a new feature. It's not really AI, it's just high reliability science that we sort of brought forward from healthcare. And we've got this feature called charge note reconciliation. So this is at its core, it's an identify and mitigate strategy. It makes it easy or easier for a physician or their revenue cycle colleague who's working in the back office behind them, see the oversights, the misses, the undercharges, the undercodes, the overcodes in real time, and mitigate those, address those in real time. Now, is that AI or is that just good assembly line science that Toyota invented decades ago? We could have that discussion. But I think we're going to see revenue cycle get lifted by a combination of AI and also just good old-fashioned production floor improvements.
Any space where there's ample data and a lot of analysis that needs to be done, AI is going to continue to flourish in, right? So it makes too much sense for AI not to have widespread adoption throughout the RCM space, right? Now, that'll still, as you mentioned, that'll still bring with it challenges. It's funny, right? Because like some people you'll run into, they think that you take an AI sticker, you plop it on a product, and it solves all potential. You're still going to have issues that come up, much like when you were building a product without AI, right? It won't solve everything, but the key is if it's solving 80% of those lingering issues that we had in the past, that's a win, right?
Those are significant wins. I think you hit the nail on the head there. At the end of the day, there's in healthcare, you've got clinical people who want to be professionally excellent for people who are sick, patients who are sick and suffering. You still have those patients that are sick and suffering, and there's something very old-fashioned and probably eternal about solving and negotiating and relating through and healing and curing those fundamental problems. But yeah, I think some of the busy work that has historically plagued both sides of that relationship, patients and caregivers, clinicians, hopefully we'll be able to iron a lot of that out with things like AI.
Well, Dr. Stein, I really appreciate you joining us here today and sharing some great research from the report. We will link this in with the episode, so whatever information that we can put out. But thank you so much for joining us here today, and look forward to future conversations.
It's a pleasure being with you today, Jared. Thanks so much.